want you all to see really quickly. So according to the cancer.org statistics, about 10,470 children in the United States under the age of 15 will be diagnosed with cancer this year. That's in 2022. That's a lot. Childhood cancer rates have been rising for the past few decades. And there have been, as Tracy said, major treatment advances and desperate parents that are looking for all options to help their children. And so this was a picture of a little girl that I've been taking care of probably for the past 5 years. And she had a glioblastoma. And basically through the course of a year and a half, she had seizures, the whole gamut, chemo, radiation, it wasn't working. And then once she started to include cannabis, the conventional treatment started to work. And currently she has no evidence of disease, no seizures, and she's off of seizure medication. And so the reason why I bring this up, because Tracy, you've been doing this with kids for a while, probably longer than I have, in the cannabis nursing space. And so what's really important for parents and what they want to know is, what types of cannabinoids did you use? What part of the plant? I know you said THC, but did you use other minor cannabinoids? What were the routes of administration? And how did you start dosing her? These are questions that parents will ask all the time. They get really, really scared. And so as a parent who's been using cannabis with your child for a while now, I think it'll be really impactful for them to hear it from you.
First of all, I'm a big believer in whole plant. When you're using cannabis that you get on the state level from dispensaries, we really have had to throw the kitchen sink at Sophie because unfortunately her tumor has such a high recurrence rate. She ended up ultimately failing 7 chemos and clinical trials. And we'll get into why that happened later, because we now know why these therapies weren't working and why cannabis was in fact not eradicating her disease. Whereas with so many other neck down cancers, I've seen incredible results. And we now understand why that's happening with brain cancer specifically. But for Sophie, we originally had guidance through other practitioners that had been in the space. They'd never dosed children before, but they had worked with adults. So we started out very, very low with Sophie with both THC and CBD. Whole plant. We originally started with the very, very thick FICO oil. We moved to tinctures because dosing with the really thick oil is very, very challenging. It's very easy to overdose because it's so highly concentrated. I mean, we were literally having to use a jewelry scale and having to put a little tip of it on wax paper and then weigh it and then put it on her pacifier. And it was never consistent dosing. So it was really, really challenging. And the last thing you ever want to do is overdose a child, especially an infant. So we were very, very careful and started off with the FICO oil with something the size of a period. Literally, that's how small the dose was. And because, again, it's so highly concentrated. And then throughout the process, we stayed on the same protocol pretty much consistently with Sophie. If I'm not mistaken, it was a 1-to-1. Again, this was like 10 years ago, and we've changed so many different times and really just tried to follow the disease. And we've had to change strains many times because what we had seen with her tumor is that it would work really, really well at first. And the tumor, because it's slow growing and the chemo can't get rid of it, the tumor has an opportunity to mutate and get smart and figure out how to work around these other therapies and continue to evade the immune system. And what we ended up discovering through Sophie was that she had no functioning natural killer cells in her brain, which is now our field of study and what our lead therapeutic is in. So to explain natural killer cells briefly, they are the main driver of your immune system. So if you think about the general in the marching army, that's your natural killer cells. And the natural killer cells regulate stem cells in all of your different organs. So for example, if you have some stem cells in the liver and they start to act up and they start to try and mutate into cancer cells, because we all have cancer stem cells in our body, the natural killer cells are the ones that come in and destroy those cells and keep them from actually turning into cancer. And it is my business partner, Dr. Anahit Jewett, 30 years of work that she's published on many, many times, where she has proven that it is the failure of this system that causes you to get cancer in the first place. So if you have a functioning natural killer cell system, cancer cannot give rise in the body. Well, Sophie had none of these cells in her brain, which is why we're finding that the cannabis was working okay. It was boosting her T cells, and T cells also play a significant role in killing cancer. But unfortunately, without the natural killer cells, the T cells can only do so much. So the T cells were doing a good job of killing the disease, but unfortunately they could only take it so far and then the disease would come back. So, as we continue working with Sophie now, she still is on cannabinoids. We have discovered that cannabis is a booster to the natural killer cell system, naturally, which is the only thing Dr. Jewett has ever discovered is a natural activator that comes from the earth. IL-2 is another form of drug that is used in immunotherapy that makes patients quite sick. But it is what is being used to boost immunotherapy. And we have found in our research that the cannabinoid that we're using was boosting the natural killer cells as well as the IL-2. So we've continued to use this in Sophie now that she has received a natural killer cell treatment. And we've got her on about 270 milligrams of CBD a day and about 75 milligrams of THC. We've also used THCA in the past, and I really believe in the secondary and tertiary cannabinoids, your CBGs, your CBDAs, your CBDVs, and also the terpene profiles can be also very, very important. And that's why it is my opinion and the opinion of all of my colleagues that you should never get dosing from social media, that you should use a medical professional who truly understands not just the plant, but also the other medications that the patient is on at that time. Because, for example, with immunotherapies, not natural killer cell immunotherapy specifically, but with T cell therapies and other immunotherapies out there today, cannabis can actually be quite counteractive to those treatments and can mitigate their efficacy. Whereas with chemotherapies, it can actually boost the efficacy quite substantially. So that's why I personally give dosing guidance. I will communicate with people what I've given my own child, but every patient is individual and every patient is on different medications that are supportive of the chemotherapies or antibiotics or, Bactrim, for example, if you have chemotherapy in place for immune function, and you have to be cognizant of those different agents and how they work within the body.
Yeah. And so that's what we same here as nurses, as clinical nurses, when we're working with families, we actually reach out to the oncologists and the team of providers if they're open to hearing from us and how we can incorporate cannabis whole plant medicine in conjunction to the conventional treatments, including immunotherapy, and then just altering dosing depending upon the days that they receive that. So it does require a collaborative approach. It does require people being able to open up their mouth and to speak in behalf of their child and to advocate for your child and to bring in a clinician that isn't afraid to speak to these providers, because and nurses were not, because nurses are always interacting with doctors all the time and even challenging them. And there's nothing wrong with that. It's a healthy interaction between nurse and doctor. And that's what we're here to do as nurses.